With the Pfizer vaccine, when do we actually expect those in long-term care to be able to access it? Like, is there any timeline yet on when the vaccine will be able to move into those homes? And just to my last question quickly, like, I don't really know, are you going to stop? Like, people just will not be able to get the vaccine until it's their turn?
Well, there's different ways of doing that. So it is accessed by where the vaccine is available. So whether it's a public health clinic or whether a pharmacy or a physician, and then how do you get into the queue to that public health clinic or that pharmacy or that clinician? So we're working on those details. One of the simplest ways to look at that is doing it by age. And that is one of the things that we across the country are looking at, with understanding that the older you are, it's the single most important risk factor for having severe illness or succumbing to COVID-19. Oh, shoot. And I know you asked me another question that I got distracted on.
Long-term care, people living in long-term care.
People living in long-term care. So I can tell you that it is changing. It's changed 3 times today already in the information that we're getting back and forth from Pfizer about handling of the vaccine. We expect that it will be able to be broken down and transported in limited ways, perhaps in the next couple of weeks, but we believe at least by the first week of January. We are also putting into the mix the fact that we believe that the Moderna vaccine will be available very soon as well, and it is more flexible in transportation. So if it becomes available sooner, then we will focus on using that vaccine to get to residents in long-term care so that we can do it without wasting any vaccine at all.
Our next question is from Justine Hunter, Globe and Mail.
Hi, thank you. Dr. Henry, it sounds like getting Moderna is going to be very critical to vaccinating seniors in care homes. I'm just wondering, I know you say soon, but do you have an idea of the timeline with that?
You know, these are things that Health Canada keeps their cards close to their chest because they are the ones that need to make sure that all of the safety and quality bars are met. We do know that they have received all of the data that they need and that they're reviewing it. So, you know, the signals are that it will be soon. But I will say we do have plans for using the Pfizer vaccine and being able to take it to care homes, particularly in the urban areas. But yes, having more flexibility in transport is something that would be very helpful, not only for care homes, but also for more remote communities that are smaller communities. And across the country, for example, we've allocated to the territories the Moderna vaccine because they don't have the infrastructure to be able to handle the large doses that come frozen with the ultra-low temperature Pfizer vaccine. So those are considerations that we have as well for some areas of the province.